Is it just aging or something more? We dive into cognitive dysfunction, pet dementia, arthritis evaluation, and simple tools, even nightlights, that can improve your pet's senior daily life.
You and I attended Dr. Busby's booth, right?
Yes.
So dementia and cognitive dysfunction are huge, and I'm sure everyone's going to be talking about it here at the conference, but there's very little we can do about it, right? Very little options out there. So what would your advice be? Maybe I can correlate both questions into one. What would your advice be? Because you relief places, so they don't, it's not like you come in there and you're creating a new perspective of their senior part. So what advice would you give for like those hospitals that they go, listen, how do we kind of implement a senior wellness protocol or type of things that we can do that we can address things? And then how do we deal with cognitive dysfunction? What do you see coming down the pipeline for cognitive dysfunction?
Yeah, I think that is a place that I would love to integrate myself more and be able to go give talks and have more of an impact. It's, an aspect of something as simple as having this sheet of paper that when Fido's coming in, he's 10, like Fido's a senior, either the technician or the receptionist, when they put them in the room, can give them this laminated sheet of paper that says, all right, your pet is now considered a senior. We recommend routine blood work because we want to catch XYZ problems early. And even if it's normal, we want to have their normals because that doesn't always mean, everyone's normal. So we want to do x-rays because that's how we actually catch cancers. Cancers don't show up on blood work. We want to check for arthritis too with that. We want to make sure that we're talking about different causes of arthritis and dementia. So have a couple little check marks of saying arthritis can look like slowing down on walks, lagging behind, not wanting to jump, those types of things. Are you noticing these symptoms? Dementia can look like gazing off into space, barking randomly, wandering at night, these types of things, not eating as well. Are you noticing any of these symptoms? And have just this simple checklist. And by the time you come in the room or the tech comes in the room, they can look at that and say, oh, okay, maybe we need to touch on these things while we're talking. And that way they better understand why we want to do diagnostics and they approve or deny them. And then we get a better picture. And we're able to talk more about that. I think with dementia, there is this misconception that there's like nothing we can do. And right now, there's nothing that reverses it. It's like chronic kidney disease. We're maintaining, but I have patients with chronic kidney disease that live 2 or 3 years too. And dementia can be the same way, and it doesn't have to be sad and detrimental and like very, terrible as an ending. There are a lot of things. I've started doing acupuncture on a dog with sundowners, and he improved after 2 sessions. He was not sleeping through the night.
I got to ask you, what points are you using?
So a lot of heart points, shin, there's bladder 1544, some kidney points. He has some early kidney disease. Okay. A lot of
That's awesome.
Yeah. And he doesn't always sleep through the night now. Like we're about 2 months in, and they say, 4 or 5 nights a week, he'll sleep through the night, a couple nights he'll wake up, but it's so much better.
That's an 80% improvement.
Yeah, and we have started him on on Dr. Busby's MCT oil as well, and adding in different things. There's also gut microbiome is looking a lot more into dementia. There's really interesting research on it in people, so why not with animals? It's pretty benign as far as a medication goes, so why not try it? So I think there's things that we can definitely do. Something as simple as a nightlight can help. I've had people tell me that like they used to wander all the time at night, and now they just put a nightlight in the bedroom and they sleep and they're okay.
Amazing.
Yeah, so it's simple things we can do, and there are a lot of things we can do to support them. And it's just knowing that it's not really like the end all. We don't just say like, oh, they're old, oh, they're gonna get dementia, oh, they're gonna wander the house all the time, because that's awful. I went through that with my dog. Like every 15 minutes he would get up and pace around, and I had a newborn at home at the time who would only sleep on me, so I'd have to get up to get him back up on the couch every 15-20 minutes. It was very detrimental for our relationship, for his quality of life, for everything like that, So I think there's a lot of things we can offer and we can do, and that people can do at home too on their own. So I think there's an aspect that we can do as veterinarians in the clinic to help just them be able to recognize those things. And then there are some things we can do to help support them in that time frame.
Wow.
Yeah.
I'm getting a nightlight. I want to prevent it.
Yeah.
When we look close, we find more. And when we find more, We can do more. Senior care is in the details. Thanks for listening. If you want to learn more about senior pet health, stay tuned for the next segment.